Welcome to Leading Organizations That Matter, a podcast about leadership, organizational culture, and how to find meaning and purpose in our work. I'm Ray Spadoni, former healthcare CEO, current consultant, author, and speaker. Today's topic is 6 reasons for-profit medicine is bad for your health. Though the majority of my career has been spent working for or supporting nonprofit mission-driven healthcare and social service organizations, I've never been one to draw sharp distinctions between for-profit and nonprofit companies. The reason is that I pretty much always bought the assertion that they really are only different in terms of their tax status, how they're legally incorporated, and that any other differences are pretty minor in reality. Also, in my career, I've come across some nonprofits that operate very much according to the for-profit mindset, while I also have worked with some for-profits. As I said, the majority of my career has been in the nonprofit realm, but not all of it. I've worked with some for-profits that are pretty highly principled and quite clearly quality and service oriented. They do the right things consistently. So it's just a tax status, right? Well, let's hold that thought for a minute. During the years that I served as a healthcare CEO, I saw a steady transition toward the for-profitization of several industry segments, including home health, hospice, health insurance, medical practices, and hospitals. If it's just a tax status thing, this shouldn't have any cumulative negative effect. Or actually, advocates of this movement would probably argue that we should actually see improved efficiency and lower overall system costs as a result of the more highly disciplined for-profit instinct. But I don't think we've seen that. In fact, we have seen some ill effects of this trend. As of the date of this episode in July of 2024, the for-profit Steward Hospital System has filed for bankruptcy, leaving the market reeling and a great deal of uncertainty for patients, their communities, employees, clinicians, regulators, policymakers, their suppliers. It's a bad situation, but I don't believe it's a one-off. I believe there are some valuable lessons learned, and I'm going to share 6 of them. What's the basis for these thoughts? The answer is that it's my own experience. It's what I have witnessed firsthand as an executive in this industry for 4 decades. Let's just say I trust my own eyes. Here goes. The 6 reasons for-profit medicine is bad for your health. Reason 1, we all bought the argument that higher efficiency equals better quality. Now, this concept is pretty well supported in the literature, and I recall going back to the early 2000s, seeing the landmark Institutes of Medicine work entitled Crossing the Quality Chasm, a New Healthcare System for the 21st Century. Since that time, there's been a great deal of evidence that when we wring out inefficiencies from places like service handoffs and clinical workflows, the quality gets better. But I have come to see that this perspective has been waved like a magic wand to declare that every and all efforts to increase efficiency somehow magically improves patient outcomes. And it's almost pretextual. We are cutting costs, and as the expression goes, therefore improving quality. We need to get back to the data and systematically verified evidence and take this argument away from the marketers, salespeople, the business development deal makers, and the venture capital purse holders. They've overused the concept, and now, as a result, we need to be more skeptical. Reason 2, efforts to game the system often cross over the line. For-profit companies try to gain profits. It's what they do. In fact, it would be quite irresponsible of them to not maximize shareholder value. They're obligated to do so. But the pressure to develop that value can become extremely intense for them. So intense that some organizations push up, right up, and maybe cross over the boundaries of appropriateness. Hence all the efforts by regulators and payers to torque up compliance efforts. Because these regulators and payers can't always differentiate between the heroes and villains that are out there, in fact, they've shown that they're not inclined to do so, they will paint with a very broad brush, creating onerous audits, increasing regulations, adding barriers to care, and reducing fair payment for the services that are rendered. The villains get what they deserve accordingly, but unfortunately, this substantially increases costs and diverts attention and energy away from other more noble and productive efforts for the heroes. The broad brush can be quite unforgiving. Reason 3, black eyes impact everyone. Back to the heroes and villains idea. Whenever the mischief makers out there and those who are attempting to gain the system for their own gain get into trouble, it also negatively impacts the public perceptions of those who are mission driven, focused on the communities they serve, and trying to do the right thing. This can adversely affect their fundraising programs, staff recruitment, and marketing efforts. Reason 4, cream skimming hurts all of us. For a variety of historical reasons, healthcare services are reimbursed according to complex methodologies designed to curb cost trends and hopefully promote improved quality. Typically, procedure-based services like ambulatory surgery or some diagnostic testing pay a lot more than the less glamorous but still highly necessary services like emergency care or behavioral health care. Enterprising business people will skim the procedure-based services off the top by creating dedicated centers just for those types of services, while others are left caring for those who are underinsured or who need the financially less attractive services. So the for-profits pull off the profitable services, which historically have subsidized things like hospital ERs, behavioral health care, and others. With the profitable items now gone, you're left holding the less financially viable services. In a word, ouch. In another word, unfair. Reason 5, short-term thinking jeopardizes long-term success. The current Steward debacle demonstrates this in spades. For-profits are under great pressure to show improving financial performance, oftentimes in order to fulfill shareholder expectations around not only their ongoing profitability, but also around payday aspirations. I've seen too many for-profit company executives motivated by near-term objectives which supersede longer-term considerations, or who are pressed to come up with the big payout and to hell with anything else. In my experience, most nonprofits take the long view, are governed by boards who take stewardship seriously and consider not only the needs of the community now, but also things like how the organization can continue to meet the demands of its mission well out into the future. Steward sold off its real estate holdings and affiliated medical practices, then other assets, such as its post-acute home care company, all in the name of generating necessary cash. But if you're thinking about the long term, the loss of those services and those assets hurt them tremendously. Reason 6, and this one is probably more subtle, but I'll describe it as the smokescreen effect. I once worked for a long period of time with a very large for-profit healthcare company many years ago, and I had the opportunity to listen in on the quarterly conference calls with investors. In those calls, the CEO and CFO gave reports on what was happening, how the numbers were looking, management initiatives, and so on. The calls were quite intense, and the questions and the comments from investors and the shareholders could be pretty pointed, like poison darts kind of pointed. And I could sense how uncomfortable this was for the CEO, the CFO, and over time, I actually began to notice a pattern. Merger and acquisition activities, divestitures, geographic expansions, new IT solutions, and other major strategic initiatives were often, very often, cited as the causes of the poor performance, and that investments in these activities would eventually pay off. My sense was that these were posed as a sort of smokescreen in order to hide deeper problems and lack of progress in solving them. Once I noticed this, I couldn't stop noticing it. In fact, I began to see that management looked for new initiatives like these in order to create a permanent sense of chaos, all in the name of creating longer term shareholder value. It was a house of cards. And it's no wonder that these sometimes come crashing down in glorious but tragic fashion. So, these are 6 reasons for-profit medicine is bad for all of us. In our industry, we want provider and payer organizations to focus on the needs of the community, to take the long view, to offer the less financially attractive services to those who most need them, rather than just focusing on top-line profitability. And we want those organizations ideally to be stable, predictable, and there for us when we need them. My own local hospital is a Steward hospital that unfortunately experienced a catastrophic flood some time ago, and that ruined the physical plant, required a total and complete teardown. After years of inaction, Steward began to rebuild the hospital. It now sits there, a foundation and shell only, boarded up to prevent rot and ruin, waiting hopefully for a new owner to someday complete construction, hopefully. But this community needs a hospital. And I hear stories all the time about the very long time that it takes to get to other hospitals and other communities and how overcrowded those ERs have become. This community needs its hospital. Doctors, nurses, and staff would like to return to work caring for the people who need them. But the silent shell of a building sits there waiting. We'll see what happens next. In future episodes, I'll provide some additional examples of how the movement toward for-profit healthcare has had unintended but negative consequences. And I'll also talk about what we, as a public, ought to do about it. I've got some great guests lined up who are going to talk about this with me, so please stay tuned. Thanks for listening. I hope that you'll consider subscribing to this podcast, telling your friends and coworkers about it, and providing a review on Apple Podcasts or your platform of choice. That helps others discover it. And please feel free to learn more about me and my work at redsaleadvisors.com.